Reversal of type 2 diabetes mellitus. Is it really a myth or a truth? We are going to have our answers shortly in this video. So what happens in type 2 diabetes mellitus is there are two things that are happening. The first is insulin resistance, wherein your body is able to produce insulin, but that insulin is not able to act on your body tissues, and hence your blood glucose levels remain elevated. The second is insulin deficiency. So over a period of time, when insulin resistance is sustained and the blood glucose levels are higher enough, so what happens is beta cells of pancreas get damaged, and there is a stage wherein the insulin production reduces, and when this happens we call it insulin deficiency, and patients in this stage generally require an external dose of insulin. Now, what are the risk factors of this insulin resistance or insulin deficiency, or we should say type 2 diabetes mellitus? The most important of them are obesity, excessive fat consumption, low levels of physical activity, and hereditary or genetic predisposition or a family history of diabetes mellitus. It is important to note that not all obese people, not all fat people end up getting diabetes mellitus. Not all people who are having low physical activity end up getting diabetes. Not everyone who has a family history of diabetes gets diabetes mellitus. Only a few percentage of people who are obese with low physical activity or a family history tend to get diabetes mellitus. In this, what is happening is there is insulin resistance because of obesity. We generally label this as the metabolic syndrome. Now, when this starts, the insulin resistance phase sets in. These patients or these people require some medications which lower down the insulin resistance in the body or increases the production of insulin to compensate for this insulin resistance. At this point of juncture wherein there is insulin resistance, if the patient is able to control the calories in the diet, have a low calorie diet, have decreased consumption of carbohydrates, increase their physical activity, and eventually promote their weight loss, or if there is a weight loss in these individuals, they generally tend to reverse the insulin resistance for a period of time. So what happens is, if they have worked out well, they have decreased the carbohydrate consumption, decreased their calorie consumption, and exercise has increased, and which has eventually led to decrease in the weight, these people generally tend to reduce the insulin resistance levels in their body, and as a result of this, the oral medications may or may not be required if the blood glucose levels are maintained within the normal levels. So what happens is, they are now set aside to be labeled as reversal of diabetes mellitus, but that's not the truth. Reversal means something happened and now it does not exist and will never happen, come what may. This is reversal. But what we should understand is, these people who have controlled their weight or helped their weight to reduce and then compensate that insulin resistance, they still have a risk of developing diabetes mellitus if they don't control their diet, if they don't control their fat consumption, if they don't work out regularly. They are still having a risk of developing that insulin resistance further up. Hence, we should not label this as reversal of diabetes mellitus. We should label this as control of insulin resistance phase of the diabetes mellitus, so that you are on minimal or no oral medications. However, there is an important point to note over here. Once a person progresses from insulin resistance to a phase of insulin deficiency wherein insulin is required, generally the reversal to a complete normal state wherein no medication and no insulin is required is very rare to occur. What can happen is, if you still control your diet, if you still work out heavily, you can at max achieve lower levels of insulin requirement or no insulin requirement with minimal requirement of oral medications for controlling your blood sugar levels. So this is the myth that we have deciphered over here. Reversal is not a reality. for type 2 diabetes mellitus. It is the control of blood sugars in the insulin resistance phase of type 2 diabetes mellitus, which is labeled as reversal by some people, which is incorrect. And now when you know the truth, you know how to take care of your diabetes or diabetes for your loved ones. So friends, if you like this video, please do like, share and subscribe, and don't forget to watch my next video. Thank you.